Hello, welcome to today's webinar, PFAS and Health Effects, Scientists and Activists Working Together. I am Dr. Barbara Malkus, Board President for Massachusetts Breast Cancer Coalition, and I'd like to thank you all for joining us today. I am pleased to welcome back today's speaker, Dr. Laurel Schaider. Dr. Schaider is a senior scientist at Silent Spring Institute, where she leads the Institute's water quality research on PFAS and other contaminants of emerging concern. She studies PFAS chemicals in drinking water, consumer products, and food drinking water contamination from septic systems, and environmental justice disparities in drinking water quality. She is the lead investigator of PFAS Reach, which stands for Research, Education, and Action for Community Health, a study evaluating PFAS immunotoxicity in children and addressing the needs of communities affected by PFAS water contamination. She is part of the University of Rhode Island STEEP Superfund Research Program and co-leads community engagement activities on Cape Cod. Additionally, she is the lead investigator of the CDC ATSDR PFAS multi-site study, also called the Massachusetts PFAS and Your Health Study, looking at the health impacts of PFAS in Hyannis and the town of Ayer. Dr. Schaider, welcome.
Thank you very much for having me back. It's really a pleasure to see you again and to be here with you and the other attendees for this MBCC webinar. So I hope that all of you have attended other MBCC webinars before to learn more about PFAS in general and why they're of such concern. And for those of you who've attended previous webinars that I've given before, you've probably heard me talk about specific research projects or about specific topics such as PFAS in food packaging or PFAS effects on the immune system. So today's talk is a little bit different because my goal is to talk cross-sectionally across the various projects and research initiatives that I have underway about how my work has intersected with the work of activists and how together scientists and activists can collaborate to protect public health. So this is a really big topic. I feel like I could spend more than just an hour talking about all the ways that our work benefits from our collaborations with activists, but I've done my best to wrangle together examples to share with all of you. And I also really want to express my gratitude to all of the activists that I've had the opportunity to work with. I'm always inspired by the dedication of the community partners that we have in our study. And in many cases, these are people who did not plan to become activists, but they really stepped up when they saw a need in their community. So I'm really grateful for everyone's efforts to protect public health. Many of you may already be familiar with Silent Spring Institute. We are an independent nonprofit research organization dedicated to identifying the links between everyday chemical exposures and health, with a focus on women's health and breast cancer. And we have a very unique origin story. We were founded by visionary activists at the Massachusetts Breast Cancer Coalition who saw the need for more research on environmental causes of breast cancer, recognizing that identifying these links would provide opportunities for prevention. Silent Spring is now a leading scientific research organization on environmental causes of breast cancer. We also continue to partner very closely with Massachusetts Breast Cancer Coalition and a range of advocacy groups in order to amplify the impact of our research. So activists have been really central to the many different types of action that have happened in recent years related to PFAS. Some activist groups, such as MBCC, have previously focused on other types of chemical exposures, maybe other categories of toxics, and are now addressing PFAS as well. I've also seen a number of new grassroots groups form just in the past, I'd say 5 to 7 years, in response to local discovery of PFAS contamination. And unfortunately, PFAS are showing up in water supplies and in the environment in dozens of communities across the country. And so there are a lot of new activist groups and new grassroots organizations that have been formed to address this challenge. And all types of activists have played key roles in shaping and supporting research, legislation, and policies on PFAS. So to start things off, I wanted to tell you about 3 of our major research studies related to PFAS. All of these have a component of working with community partner organizations. And I wanted to explain these 3 studies at the beginning because throughout my talk, I'll be referring back to these studies and the different ways that we're partnering with activists and that our work is striving to provide resources for PFAS impacted communities. So the first study that I want to tell you about is called STEEP, which is Sources, Transport, Exposure, and Effects of PFAS. This is a Superfund research program funded by the National Institute of Environmental Health Sciences. STEEP is led by University of Rhode Island. It includes Harvard University and Silent Spring Institute researchers as well. It's a 5-year study looking at PFAS health effects, exposures to PFAS, the movement of PFAS in the environment, and their chemical properties. My main role in STEEP is to co-lead the Community Engagement Corps on Cape Cod. We're conducting a study of PFAS levels in private wells on the Cape. We also host and attend community events and engage closely with our Community Advisory Committee. For our STEEP Community Engagement Corps, we work closely with Massachusetts Breast Cancer Coalition, Sierra Club Cape Cod Group, and most recently, we've also begun collaborating with the Mashpee Wampanoag tribe. Other parts of STEEP include, beyond the research components, include a research translation core, which takes the new research findings of the STEEP researchers and translates them into a variety of formats, including fact sheets, podcasts, videos, webinars, etc. The second study that I wanted to tell you about is called PFAS Reach, which is Research, Education, and Action for Community Health. I'm the lead investigator on the PFAS Reach study, together with our research partners at Northeastern University and Michigan State, and our community partners, Massachusetts Breast Cancer Coalition, Testing for Peas up in Portsmouth, New Hampshire, and Community Action Works, formerly known as Toxics Action Center. The PFAS Reach study has 3 main components. The first is a study of PFAS effects on children's immune systems. We're currently enrolling children in Hyannis on Cape Cod and at the Peas Trade Port in Portsmouth, New Hampshire to take part in this study. The second component is the PFAS Exchange, and I'll refer back to this a number of times in the talk today, which is an online resource center intended to be useful for a range of audiences, most especially PFAS impacted communities. The PFAS Reach study is also conducting a social science analysis of the experience of affected communities and understanding how different communities and different members of communities respond to knowledge about PFAS contamination. The PFAS Reach study is funded by the National Institute of Environmental Health Sciences, and specifically their Research to Action program, which funds projects that already consist of existing collaborations between researchers and community partners. And then the third study I wanted to mention is the Massachusetts PFAS in Your Health study. This is part of a multi-site study that's being led and funded by the Centers for Disease Control and Prevention, or CDC, and by the Agency for Toxic Substances and Disease Registry, or ATSDR. So Silent Spring Institute is leading one of 7 projects within this multi-site study. We're collaborating with researchers from Harvard School of Public Health and Eastern Research Group, and our local partner in Hyannis is Massachusetts Breast Cancer Coalition, and our second site is the town of Ayer, west of Boston, and we're working with the people of Ayer concerned about the environment, or PACE. So Hyannis and Ayer are our 2 communities for this study, and the goal is to investigate links between PFAS exposures from drinking water and a range of possible health effects in both adults and children. Another component of the study involves reconstructing past exposures by better understanding the timing and extent of PFAS contamination sources in the vicinity of the public water supplies. And enrollment is now just started underway in Hyannis, which is the first phase of this study. So through my work, I've had the opportunity to meet and get to know community members in a wide range of communities across the country. Each community has their own specific needs and concerns, but I hear many similar threads in terms of what communities are seeking. Drinking water is a top priority for many communities, so residents are wanting information and wanting monitoring of PFAS in drinking water and treatment to address contamination issues. They see the need for drinking water standards and other regulations. They want to know more about PFAS in their local environment, food, fish, and other local exposure pathways. They're interested in knowing more about PFAS biomonitoring, so getting blood testing so that they can know the extent of their individual exposures. They're looking for guidance on medical monitoring. So once their exposure has been identified, how can they communicate with their doctors so that their doctors can know about their exposures, can provide guidance, and keep an eye out for possible health effects that may be linked to their individual PFAS exposures. Many communities are also seeking out health studies as well, recognizing that past exposures can't be changed, but then we can learn from them and do a better job at protecting future generations. I wanted to show here some images provided by Lorene Hackett, who's an activist in Hoosick Falls, New York. This was a community that had PFOA contamination from a local industrial facility. Communities are met with a number of challenges in meeting these needs that they've identified. Blood testing is often unavailable and can be expensive. Their medical professionals are often unfamiliar with PFAS health concerns and may not be well equipped to answer their questions. Some states aren't doing any drinking water testing currently, or are only testing for a limited number of specific PFAS compounds. There's no federal drinking water standard yet established by the EPA, and many states have not set their own standards or guidelines yet either. There's little information about PFAS levels in fish and other local foods, and it's difficult, and there are often few opportunities to be part of a health study. And I wanted to highlight this quote from Andrea Amico, who's a co-founder of Testing for Peace and someone I've had the opportunity to work with closely through the PFAS Reach study. And she highlighted that despite the significant impacts of PFAS contamination, impacted communities struggled to be seen as critical stakeholders. So in framing the presentation for today, I felt like there were a lot of different directions that I could go with this discussion, but here are some common threads and some common points for discussion that I'll go through. So I wanted to talk about the process of discovering contamination and how communities respond to that information, the challenges and resources that we've developed related to biomonitoring for PFAS levels in blood, talk about how community partners can play a vital and central role in exposure and health studies. I want to talk about medical monitoring and outreach to clinicians, both the challenges and approaches that we've developed to meet the needs of affected communities. Talk about ways that scientists and activists can together collaborate on public outreach and education efforts and on informing legislators related to proposed regulations or policies. And I'll wrap up with a few general conclusions. So I wanted to start first at the beginning, which is where a lot of communities are at the beginning. They may never have heard of PFAS before and then suddenly discover, wow, we have these chemicals in our water supply and we don't know what that means. Here in Massachusetts, the Massachusetts Department of Environmental Protection established a standard last October requiring testing of PFAS in public water supplies and setting a strict standard, much stricter than the EPA guideline, for the levels of 6 PFAS chemicals in drinking water. And as a result, more and more communities are finding PFAS in their water supply, and a growing number of communities are finding that some of their source waters have PFAS levels that exceed this new state standard. If you live here in Massachusetts and you want to learn more about testing that's been conducted by your water supply, I'm showing here a link to a state website where the Department of Environmental Protection has compiled information about testing. You may also be able to find out information by contacting your water supply directly. Silent Spring actually has been on the trail of PFAS in drinking water for over a decade. We were the first to find PFAS in drinking water on Cape Cod, starting with a pair of studies of public and private drinking water wells in 2010 and 2011. From this early work, we saw that PFAS were present in a number of the wells that we tested. We saw that levels in Hyannis public wells were higher than other wells that we tested, and this was confirmed by subsequent testing that showed that PFAS levels in the Hyannis public water supply used to be higher than in any other public water supply in Massachusetts. Our work also showed that there are a range of different PFAS chemicals present in water and highlighted the potential role of septic systems entering as a pathway for PFAS to enter groundwater from households. So when we started this work over 10 years ago, and this continues today, water quality is a major concern on Cape Cod. And the main concern hasn't necessarily been on PFAS in the past. It's been on nutrient pollution. So because of excessive levels of nitrogen from septic systems getting into groundwater, that's causing visible degradation of water quality, both in ponds and in coastal waters. And so a number of towns on the Cape are proposing upgrades to wastewater infrastructure, and they're really focused on addressing these nutrient pollution issues. So through our research, we've been able to support advocacy efforts to extend the focus of water quality concerns to also include emerging contaminants. So we've thought about links between where wastewater gets put into the ground and where drinking water supplies get pulled from. We've thought about associations between the levels of these emerging contaminants and nitrate, which is a commonly measured contaminant, and one of the central things that are measured related to the nutrient pollution concerns. And we've also engaged with local advocacy groups in thinking about how we can stop pollution at the source and really recognizing the chemical footprint that all of us make in terms of the impacts of the products that we buy and their ultimate fate of the chemicals they contain. So I received questions from a growing number of communities, both locally and across the country. And I hear a lot of the same questions and concerns when communities find out about PFAS in their drinking water. They want to know where the PFAS are coming from. They want to know how the chemicals might affect their health, whether past exposures are having effects on specific health conditions. They want to know about water filtration and what types, should they buy a water filter and what type. They're curious about whether it's safe to take a shower, whether it's safe to water their garden in their backyard with plants that they plan to eat. And they want to know more about what they can do to prevent this type of issue in the future. So to address these questions, our work involves a wide range of responses and ways that we engage with local communities in partnership with our Mass Breast Cancer Coalition and other community partners. Here are some examples from our STEEP project. These photos were taken pre-pandemic when we used to be able to have large gatherings of people all in the same room. We made a point to organize annual STEEP Science Days where we would bring residents and high school students together to talk about our research findings and to hear and learn about their questions. We met with health agents. We attended community events to talk with people about our work and shared information about our research findings in accessible ways. So for instance, a fact sheet where we summarize results of our private well testing program. For individuals taking part in our study, we have a lot of expertise at Silent Spring Institute about effective ways to report results back for individual chemical exposure testing. So this tool is called Derby, the Digital Exposure Report Back Interface. And here's an example of how we use the Derby tool to report back the results of private well test levels for our STEEP private well participants. In addition to having graphs and text to provide context for results, our Derby reports also provide additional resources on where PFAS come from and what individuals can do. We know that having that empowering step of action is a really important part of telling people about chemical exposures that they may have had. So you can see more about that on the Silent Spring webpage. To address community concerns, we've also developed a series of fact sheets, which are on the PFAS exchange about reducing exposures, about health effects, drinking water guidelines, and water treatment. Another way that we empower and engage with communities is to tell them about other community groups that are also tackling similar challenges. So our PFAS exchange also has a connecting communities map where people can learn about contamination sites in their community and community groups that are tackling PFAS issues in their state. We also provide resources for people who may be interested in starting up their own community group if they live in an area where there aren't existing community groups. I also want to let you know that a new version of this map will be released soon. It's a different format, a little bit more user-friendly format that will continue to provide information about community resources, community groups that are taking action on PFAS, state action, whether states are implementing drinking water standards or action plans, and more information from the Northeastern Social Science and Environmental Health Research Institute with locations of known and suspected contamination. For more different types of resources, you can also visit the STEEP website as well. So then I wanted another topic and another challenge that communities encounter is the topic of biomonitoring. So the idea is by measuring the levels of PFAS in a person's blood, that can tell you about the extent of their exposure in recent years. And community groups have been really successful in some states in advocating for blood testing. So for instance, in New Hampshire, testing for Ps and the Merrimack Citizens for Clean Water have supported state biomonitoring programs to understand at a community level how exposures at the Ps trade port and in the city of Merrimack compare with other communities, and have shown the extent of exposure to PFAS related to contaminated drinking water. But there are challenges with accessing blood testing. So a major barrier is the cost. For individuals, insurance doesn't typically cover the cost of PFAS testing. So for an individual to try to get blood testing, it can cost hundreds of dollars for testing one single blood sample. Also for state health departments or local municipalities, the cost of PFAS testing can also be a barrier. There are only really a handful of laboratories that have sensitive testing methods for measuring PFAS, and current testing methods may miss new PFAS that are now in use. And this is particularly of concern in communities near PFAS manufacturing sites where newer PFAS that are not currently included in blood testing may be exposed to. More broadly, there are some other challenges that communities often encounter related to blood testing. There's a perception among certain health departments or scientists that testing for PFAS in an individual's blood might just be alarming. In fact, all of us, over 99% of Americans, have traces of PFAS in our bodies. And no one wants to receive news that they have these toxic chemicals in their bodies. So there's a concern that doing this individual testing might alarm residents, particularly in areas where exposures are quite a bit elevated above typical levels. Results of PFAS blood testing can be difficult to interpret. There's no way at this point to make a direct link between the result of a PFAS blood test and a certain health outcome. So linking results to an individual's health conditions is really difficult, if not impossible. I wanted to mention a science panel that's currently been organized by the National Academies, which is really speaking directly to some of these challenges related both to blood testing and to medical monitoring. It's called the Guidance on PFAS Testing and Health Outcomes. And so this science committee is tasked with several specific objectives. They are supposed to assess the evidence for human health effects for the most studied PFAS chemicals. They're tasked with developing general principles for biological testing, so PFAS blood testing, or for clinical evaluations, so when people talk to their doctors about their PFAS exposures. This committee is also tasked with advising the CDC and ATSDR on their current clinical guidance and advising whether updated resources are appropriate. I think that the National Academies has done a great job in making sure that the voices of PFAS impacted communities are reflected throughout the process of this science panel. They've put together a committee of community liaisons. These include both activists as well as scientists to make sure that, that the science panel is hearing the perspectives of PFAS impacted communities. The National Academies also hosted a series of town hall sessions, and I was fortunate to be a session chair for one of these panels. And if you're interested, I would recommend watching them. There are 10 to 15-minute presentations from community groups all across the country, and I really learned a lot by listening to many of these presentations, hearing the common themes, and also noting that each community has some different and unique challenges. One of the takeaway messages that I heard was ignorance is not bliss. This was a quote from Tracy Carluccio at the Delaware Riverkeeper Network. And this was related to communities wanting PFAS blood testing, that even though you can't necessarily make a direct link between a PFAS level in blood and a health outcome, communities still want to know. They want to know what their exposure has been. They understand that the results won't give definitive answers about illness. They see this information as really critical for setting a baseline for future testing. They want to know whether the water treatment that is being installed in their community or other exposure reduction methods are being effective at reducing their exposures. They also recognize the potential for this information to be a part of their medical history and to help their clinicians in the future make sure that they're giving appropriate medical care for any health conditions that they may have in the future. I wanted to mention the What's My Exposure data interpretation tool that we've developed for the PFAS exchange. So the goal for this tool is to help people in interpreting the results of blood testing. These could be results that they get individually from a lab or results that they receive from taking part in a BioMonitoring program or a PFAS health study. So our PFAS exchange data interpretation tool draws really heavily on the Derby tool and the expertise of our team at Silent Spring Institute in different ways to put results into a context for this type of testing. So a user can come to the PFAS exchange website, enter the results of blood testing. We also have a separate section for drinking water test results as well. And the tool will automatically generate a text headline to help interpret and put the results into a context of the general population. It will generate graphs as well to show how an individual's results compared to the general population. And it provides other information about community level exposures, so in areas that have had biomonitoring conducted at the community level. And there's information about sources of PFAS exposure, health effects, and exposure reduction. We have additional resources coming soon, so we are undergoing a series of upgrades to the graphs for the PFAS exchange data interpretation tool. We're also developing new resources with information about questions to ask when seeking blood testing from a laboratory and specific information about the blood testing capacities of a range of testing laboratories. I also wanted to talk about how working with communities has directly benefited the exposure and health studies that I have had the privilege to lead or be a part of. In my experience, community partners are central to developing and implementing effective health studies. Community partners can help with supporting recruitment and making sure that studies are connecting with diverse communities. I wanted to give huge thanks to MBCC's director, Cheryl Osimo, who I've had the privilege to work with since 2009. She's been our key community partner for all of our health studies in Hyannis. And I have a couple pictures of her here at the Maranatha Church, which serves Brazilian residents in Hyannis, and at the Baby Center, which is provides resources for low-income families with young children. And having her presence there and having her attend and meet with residents in many different venues is a really critical part for us to have effective recruitment and to make sure that we're recruiting a diverse study population. Working with community partners provides connections and credibility with local stakeholders that you may not have if you're a scientist and you're just beginning new work in a new community. Community partners also, in my experience, have a lot of expertise about the site history themselves, and they're often quite knowledgeable about the history of the site and information about other contaminants that may have been found in the past. I wanted to mention that for our work with the multi-site study in air, our community partners from PACE, this is People of Air Concerned About the Environment, have really been a great partner for us to get to know the town board of health and other committees in town. And they've also been providing amazing support in terms of helping our team learn more about the Fort Devon site and also to review fire logs, which will provide specific information to help us in our historical reconstruction. And I really like this quote from, I don't know who came up with it first, but it's from the National PFAS Contamination Coalition, which says nothing about us without us. You know, if you're doing research in a community, it's just really vital to have community partners be a part of the study from the beginning. I also wanted to mention this study, which is an example of community partners working directly with researchers to lead a health study and to publish a research article about their findings. So this was a study that was conducted in Merrimack, New Hampshire, and it brought together local grassroots activists from the Merrimack Coalition for Clean Water, together with Community Action Works and with researchers from University of Vermont. And this was a community-led health study that provided new information about the prevalence of certain illnesses in the community. So I thought this was a really great example of how the community can play a really leading role in developing new research. So now I wanted to talk a bit about the another topic that I hear from community groups is about medical screening and outreach to clinicians. So the idea of medical monitoring or medical screening, and there's some slight differences in the definitions for those terms, that if you know someone has had high PFAS exposure, we know that they may be at greater risk for certain diseases that have been linked to high levels of PFAS exposure. And so it's helpful to think about, well, are there certain tests that a person's doctor could run to keep an eye out for whether there are any adverse health effects related to that PFAS exposure? For instance, monitoring cholesterol levels, or checking thyroid hormone levels, or maybe doing early screening for certain types of cancer that have been linked to PFAS exposures. There's an example of this from the C8 study in West Virginia. And if you've seen the film Dark Waters or the documentary The Devil We Know, you've learned about the community in West Virginia where the local community was contaminated by a DuPont plant, and a lawyer named Rob Ballot was able to find justice for the community, and there was a settlement with DuPont, part of which provided medical monitoring for impacted residents in nearby areas. So, so that's really a great model and something that we've thought a lot about in terms of providing guidance for communities who are seeking medical monitoring in their own individual healthcare to help protect their health in the long run. So to that end, our PFAS Reach team, both scientists and community leaders, collaborated with physicians to come up with medical screening guidance documents. These were very much inspired by the work of the C8 study, but extended that work to include other PFAS chemicals as well, and new science linking PFAS exposures with certain types of health outcomes. And this was motivated by the fact that we heard from many affected community members that the existing guidance was not really meeting their needs, that the guidance from the ATSDR and CDC, they felt did not allow their physicians to provide them with the kind of attention that they thought their PFAS exposures merited. So our guidance was designed to more directly provide information about the types of laboratory tests that clinicians might want to consider for people who've had high PFAS exposures. This could be related to environmental contamination or to occupational exposures. So this is a pair of documents that our team developed and finalized earlier this year. One of the documents is more of an overview for people in PFAS impacted communities, providing information about where PFAS comes from and providing information about the weight of evidence for different types of health effects that might be associated with PFAS exposures. And then the other document is specifically geared for clinicians and their patients with specific suggestions for medical tests that are that they may want to consider based on what we know about how exactly PFAS can be harmful to our health. We've heard from a number of communities some of the challenges that they've had in seeking medical or support from medical professionals. So medical professionals actually receive very little environmental health training, and so they're often unfamiliar with PFAS or other environmental chemicals. And another challenge is that the types of health effects that PFAS have often aren't unique. So even in an area with PFAS contamination, it's possible that the main types of health effects aren't standing out. It's not something that they see because these are health outcomes that can be associated with other types of risk factors as well. I was really encouraged from listening to the National Academy's panel to hear that some doctors are starting to ask about exposure history. It's not really routinely done, but from what I heard, some doctors are starting to do this, particularly in areas where they do see clusters of rare diseases. Another suggestion that came out from the National Academy sessions that I heard was that state health departments may be able to help with some of this physician education. And from my experience, community members are often very knowledgeable about PFAS. Sometimes the way that I find out about new important PFAS papers is by going on Twitter and seeing what activist groups are tweeting about. So I'd love for there to be a way where the knowledge of community members can be turned around and be used to help inform medical professionals. In terms of next steps for our PFAS Reach team with outreach to medical professionals, we are looking to disseminate more broadly the guidance documents. We're currently in the process of planning a webinar for clinicians with staff at the Nantucket Hospital, and this was a linkage that came about thanks to the Nantucket PFAS Action Group. We're also planning additional fact sheets on PFAS and vaccine effectiveness as well, because this is another question, especially these days with the COVID vaccine, where people have questions about whether PFAS exposures may be affecting vaccine effectiveness. Another way that I've had a lot of opportunities to collaborate with advocacy groups relates to public outreach and to education. So I wanted to mention in particular a pair of national PFAS conferences that were held at Northeastern University in 2017 and 2019. And this was a different type of conference. So as a scientist, I go to a lot of conferences where pretty much everyone else is a scientist, either in academia or at a nonprofit or a government agency. These conferences were really centered on community concerns. And each of the panels included a member of a community so that those voices were heard consistently throughout the conference. So this was a really innovative and multidisciplinary approach to bring together people who might not ordinarily meet up at any type of conference. There were sessions on science, on policy, on litigation. There were technical sessions on remediation and information about new regulations as well. And I didn't list out all the partners that contributed to the formation of these two conferences, but the organizing team consisted of scientists and community members. And we're grateful to the National Institute of Environmental Health Sciences for their support for these conferences. And reflecting the goals for the conference, the people who came to the conference really represented a lot of different sectors. So there were members of impacted communities, scientists, government officials, NGOs, water utilities, journalists, industry representatives, and lawyers. And I thought that it was really just a great opportunity to hear a lot of different perspectives and to really elevate the voices of PFAS impacted communities. Another one of the really great outcomes from this, from the 2017 conference was the formation of the National PFAS Contamination Coalition. So this is a network of grassroots groups that are addressing PFAS contamination in communities all across the US. Again, this was formed after the 2017 National PFAS Conference. And now this group has grown to include 18 groups in 16 different US states. The coalition also has a network of allies who are scientists and other NGOs that support the work of the coalition. We had planned for the third conference, and I've been pleased to be one of the members of the organizing committee for the other two conferences as well. Our organizing committee had planned for the third conference to be this year. Obviously with the pandemic, that kind of put a damper on our plans, but we are planning for an in-person conference with remote connection options next summer in June of 2022. And this one will be held in North Carolina in the Cape Fear River area, which is an area that's had PFAS contamination related to industrial sources. So other ways that I've been able to work with activists and to share information and reach a broad range of audiences with information about PFAS include our STEEP Let's Talk About PFAS webinar series. We developed this series in response to the pandemic when we couldn't be out in the community and talking with people and having our in-person events. So we put together a series of 4 webinars earlier this year that was organized by STEEP, and we worked closely with Cheryl Osimo from MBCC in developing these webinars. And we aim to pick major topics that we thought would be of both local and national concern. So PFAS in drinking water, PFAS-related health effects, PFAS in consumer products and how to avoid them, and new information about PFAS in surface waters on Cape Cod, and new testing methods to tell us more about the full suite of PFAS chemicals in environmental samples. So if you're looking to get some primers on PFAS, I'd recommend you go to the STEEP website to view the past webinars. And for those of you who are attending, I don't need to tell you about the great work that MBCC does in putting together a webinar series that really bring together diverse perspectives from scientists and medical professionals and activists, not beyond just PFAS, to guide MBCC's work. I'm really been grateful for the for working with activists as well to make sure that our work is informing the legislative process as well. And there's really a lot happening with PFAS, not so much at the federal level, but more at the state level. So as I said earlier, there are currently no federal drinking water standards for PFAS. EPA is working on a drinking water standard specifically just for 2 PFAS chemicals. It remains to be seen if those levels will be as strict as the guidelines or standards that individual states are setting. And there's been little action in terms of restricting the use of PFAS in things like consumer products or food packaging. There is really a lot happening at the state level in terms of new policies and regulations related to PFAS in drinking water, food packaging, firefighting foam, and consumer products, just to give a few examples. And for those of you who participated in other MBCC webinars, you know that MBCC is doing a lot at the state level, for instance, on supporting a bill related to banning PFAS in food packaging. And there are really important roles for both scientists and activists to play in this process. There are many examples I could cite, but I'll just mention one here in Massachusetts. As I mentioned, last October, the state instituted a new drinking water standard for the total amount of 6 PFAS in drinking water. And the origins are the initial motivation for the state to consider a new drinking water standard came from a petition from the Conservation Law Foundation and from Community Action Works, then called Toxics Action Center. So through this process, there were a series of opportunities for scientists and others to provide comments on the proposed standards. And so this is a couple of pictures here of myself and Cheryl testifying at a Mass Department of Environmental Protection public hearing related to these new standards. And I really appreciated having advocacy groups let me know when there are bills that are being considered, when I can have an opportunity to share my scientific knowledge. As a scientific organization, we don't tend to lobby for certain rules or legislation, but what we are able to provide is scientific information for why these chemicals are of concern and the ways that new regulations can better protect public health by reducing exposures. If you're curious to know more about what's happening in Massachusetts or in other states, I'd recommend that you check out the Safer States website. Safer States is a diverse coalition of advocates, policymakers, scientists, and representatives from PFAS impacted communities. And I find their websites very helpful for tracking state policies that have either been adopted or are currently under consideration. So I wanted to offer a few final thoughts here. So when we talk about communities, we're often thinking about geographical areas. So a town or a city or a region that is facing a common contamination issue. But one thing that I have heard both through the National Academy's town halls and just from talking to many different advocates is that not all communities are geographic. So vulnerable groups could be based on on things like occupation. And so especially firefighters and their potential PFAS exposures have gotten a lot of attention and concern in recent years. I wanted to mention the work of Your Turnout Gear in PFOA. Diane Cotter and her husband have done a lot to highlight concerns about exposures to PFAS in firefighter turnout gear. And firefighters may already have elevated exposures related to their contact with the PFAS-containing firefighting foams, and when fighting fires, the presence of many PFAS-containing products in people's homes that could also be a source of exposure to firefighters while they're fighting fires. I also wanted to mention the San Francisco Women Firefighters BioMonitoring Collaborative. Silent Spring Institute is one of the research partners in this collaborative, which has done work to evaluate exposures among women firefighters relative to other types of occupations. Another thing that came out pretty clearly in the town hall sessions from national academies and that's really important to think about are environmental justice concerns and the potential for exposure disparities. So thinking about PFAS as just one type of harmful exposure or one stress on communities that may already have a lot of other exposures or stressors. It was also a really helpful reminder to me in thinking about what advice I share with people who want to do something about PFAS exposure, because there are disparities in exposures that can be related to socioeconomic factors. So thinking about the limited ability of certain individuals or communities to afford water treatment in areas that have identified water contamination. Our advice often focuses on people's consumer product choices, but it's important to note that people who rent rather than own their own home, they have limited ability to do things like change out carpets or to buy new furniture. These topics were inspired by a presentation by Lamicia Whittington at the North Carolina Black Alliance. She specifically mentioned fast food workers who can't avoid handling fast food wrappers, many of which our previous work has shown contain PFAS. And another bit of advice I often share with people is to try to eat more fresh foods because we know PFAS can be present in a lot of types of food packaging. But people who live in food deserts can't necessarily access fresh foods and are more reliant on more heavily packaged foods. So I think it's a really important reminder that there's only so much that providing advice to individuals can do, and that we really need to work for systemic change so that we can reduce exposures among the entire population. So as a scientist, I wanted to think about how can scientists show up and be good allies for communities. I think part of this is to show up, to be present in communities in person as much as possible, or via Zoom these days with the pandemic, to make yourself available to community members, and to be a resource to local media. I know that can be uncomfortable for scientists, but talking to local media is a really important way to reach out to a broader audience of people. You have to be honest about what you know and what you don't know, but to try to lead with what you do know and not just focus on the uncertainties, because it's really important that you explain why you're concerned about PFAS chemicals or what you do know. It's important for those of you doing health studies or exposure studies to make sure that you're involving communities throughout the entire process. And if you're doing a study where community partners are contributing in substantial ways to your projects, make sure that you are paying them and recognizing their expertise financially. I do always like to end with some steps that you can take, again, with some caveats about that, it really shouldn't come down to individuals having to take steps in our daily lives to avoid PFAS chemicals, but also wanting to provide people with information about things that they can do right now to reduce their exposures. So some immediate things to do to reduce PFAS exposures include things like avoiding microwave popcorn and eating more fresh foods, skipping stain-resistant coatings for furnishings. I didn't talk about retailers, but there's really a lot of action coming from retailers making pledges to avoid PFAS in the products that they're selling. You can take steps to support stricter chemical safety testing, learn and share information that you gain from attending webinars such as these with other people that you know, and stay up to date about state and local legislation. If you haven't already, you could check out our Detox Me smartphone app with more tips. And I wanted to share a list of resources if you want to learn more about PFAS or about community responses. And with that, I'll just share my contact information and really grateful for this opportunity to be here again today.
Thank you so much, Dr. Schaider, for that really informative presentation. I know that it has been an honor for MBCC to participate with your teams in the various research projects that you've already outlined for us today. Could you just elaborate on how important it is for our MBCC supporters who are on this webinar with us today, how important it is for you to have that partnership with an advocacy and education, as well as support for research organization?
Mm-hmm. I mean, as I mentioned, Silent Spring has its roots in this partnership with Massachusetts Breast Cancer Coalition. You know, we aim to do research and science for the public good. And so partnering with MBCC really allows us to make sure that the questions that we're asking are relevant more broadly to protecting public health, to informing policy, to providing information that individuals can use. We've really benefited from all the platforms and the networks that MBCC has to amplify our message. These webinars are a great example. The Let's Talk Prevention Tour, all of these represent ways that information about our research can reach many audiences that we couldn't necessarily reach on our own. I've also been really grateful for the legislative involvement that MBCC can provide, and the way that MBCC provides opportunities for us to share our research information in a way that can inform policies. And I can't say enough good things about Cheryl and her extensive network and advocacy on Cape Cod, and having that local partnership for our work in and around Hyannis has just been invaluable.
Thank you. We have received a few questions. And this first question, you really get a sense of the level of frustration of people who live in communities where this is a concern. The question says, it's great that our state is holding towns to a much higher standard. However, until the town gets this fixed, how worried should citizens be with the discrepancy between existing levels of PFAS and the new state standard?
Yeah, it's a great question. I'm not sure I exactly know how to answer that. I think it is really confusing, and I have this challenge when I'm talking with people who found that there's PFAS in their public water supply or in their private well. This sort of patchwork approach that we have, where some states, like here in Massachusetts, a water supply would have to turn a well off or put in new treatment, and if that same water supply was in a different state, no action would be required, and we might not actually even know about the contamination. So it is really challenging, and like I said, there's no way to make a direct linkage between a certain level of exposure and the health effect. PFAS have no known benefits, and so always lowering exposure to the extent possible can only be beneficial for people's health. I understand the challenges that people face if water contamination is of concern. We do have resources for information about water testing and treatment. I don't know if this is where this question is coming from geographically, but there are ways to find out about the levels of PFAS in the water. And I guess I would end by saying that our PFAS exchange tool can help at least put the results into a context to understand how communities compare to each other, but that doesn't address the sort of underlying questions of, is this water hurting my health? Will it affect my health in the future? And so as much as possible, we're trying to take a precautionary approach and reduce those exposures when we can.
And then, you talked about equity, and I think about, if you have the wherewithal to, bring in a water purification system, or to purchase, bottled water that's from outside of your area. But there are many people who maybe cannot afford to do those as remedies? And are they even good remedies, Dr. Schaider? Is that something that people should be doing?
Sure. Well, you had a couple of suggestions there. I mean, in general, I don't point people to bottled water for a couple of reasons. One is that there's really no testing for PFAS in bottled water. So you don't necessarily know, even if the label has a picture of a mountain stream on it, you don't know that that's necessarily pulling from a pristine area. A lot of bottled water is just bottled tap water. And that doesn't even address the environmental footprint of bottled water, which is, you know, very unsustainable on many levels. We do try to point people more towards water filtration if PFAS are a concern in their area. You know, for public water supplies here in Massachusetts, they are having to meet the new stricter standard. So it's important to know more about what your water supply is doing. Sometimes there are steps that residents can take to make their voices heard. It's expensive for a community to put in water treatment, and if you live in an area where it's not required, there might be pushback from people saying, you know, why are we worried about parts per trillion levels of PFAS in the water? You know, might this money be spent better somewhere else? So you can lend your voice to support water supplies that are taking measures to reduce exposures. And we do provide information about home water filtration as well. There are two general types of filters that can remove PFAS from drinking water. So activated carbon filters, such as a solid carbon block filter or an under the sink kind of solid carbon block. There's also reverse osmosis systems that can be used at the point of use. There's kind of some varying evidence in terms of their efficacy at removing a full range of PFAS chemicals in drinking water. Depends a little bit on how high the levels are and certain properties of the water. But you can at least reduce the levels of PFAS with filtration, but it's important to make sure that the type of filter that you have has some sort of third-party certification to make sure that it's been tested to see if it does offer PFAS removal ability. But it's a challenge, and not everyone can afford water filters. So it really has to be more of a systemic change rather than leaving it up to individuals, because that will only exacerbate disparities.
There were several questions regarding risk and risk assessment, particularly with regards to food containers, and certainly more exposure would increase risk, but what are the other risk factors? For example, cookware and other containers. Are there regulatory standards outside of just the consideration of drinking water?
Mm-hmm. Yeah, this is a great question and really an area of active research right now. If you live in an area with PFAS water contamination, then for residents in those communities, it's likely that drinking water is the main source of exposure. If you're fortunate to live in an area where PFAS aren't present at high levels in the water, there are other sources of exposure. So the question mentioned food packaging or cookware, which can introduce PFAS into food. PFAS can come from the food itself. So for instance, fish or shellfish might accumulate PFAS from the waters where the fish are growing, or other types of foods can accumulate PFAS. And then there's the role of consumer products as well. So stain resistant carpets or furniture, just to name one example. So the FDA does have restrictions on certain types of PFAS in food contact materials. So this includes food packaging and other materials used to process food. But it doesn't apply to all types of PFAS. And a lot of scientists are concerned that it doesn't go far enough in terms of avoiding PFAS ending up in food. Just this year, the FDA actually changed its approval for a newer PFAS chemical, which had previously been allowed to be in packaging, based on new science, actually from FDA researchers showing that these newer PFAS were more toxic than previously thought. So I think findings like that really point to the need to address PFAS as a class, to not kind of take this whack-a-mole approach. You know, some of the other webinars we've talked before, Dr. Malkus, about you know, phasing out certain PFAS chemicals and replacing them with other ones that look almost the same chemically. When we have these really persistent chemicals that don't break down and raise a range of health concerns, we really need to do what we can to avoid their use as a class.
I know it's hard to believe, but that brings us to the end of our hour. I want
There's
to
always so much more to say.
And there is so much more on this topic, and I know that we will be meeting again for future webinars and future opportunities to provide more and more information as the body of research that you're contributing to grows. So I want to say thank you on behalf of Massachusetts Breast Cancer Coalition for all the work that you do and continue to do. And we will continue to be your advocate in partnership with you as our scientist. Thank you.
Thank you for everything.